So now let's talk about what Cyberknife can do for our patient. In the older time, you have on the top three, you have a very old machine. These days, on the bottom, you have a state-of-the-art linear accelerator, and also we have the Cyberknife. We already talked about this, right? We already talked about this. So this is a typical example of old conventional radiation to the left, comparing with the Cyberknife to the right side. In older time, when we try to treat the less lung tumor, we will damage a lot of tissues. Versus these days, with radiosurgery, we focus on the tumor itself. This is the prostate cancer as well. You see, when we do the MRT on the left to the prostate, we only have 80% of a local control. With the prostate SBRT using Cyberknife, only 5 treatments instead of 40 in conventional radiation. Only 5 treatments. The low risk patient survival is almost 100%. Basically, the red is the tumor. The white is the dose delivered by Cyberknife. And you already see this spinal case before. So on the left side is the conventional radiation. On the right side is Cyberknife. So this is the Cyberknife comparing with other radiation. This on the left side, the conventional radiation treating lung cancer. This is the Cyberknife in the middle. On the right side is the proton therapy. And you can see from this picture, proton therapy proton therapy is actually as good as a conventional therapy. However, may not be ideal for lung cancer. Is probably not as good as the Cyberknife, as the SBRT. So this is what you can see. So comparing with conventional radiation therapy, Cyberknife treatment only take 1 to 5 treatments, 1 week. And versus conventionally is 7 weeks. Every time is give 200 units. And the accuracy is 3 millimeter in conventional radiation therapy. And it takes a long time to cover, it's more toxicity versus Cyberknife, because its precision is a 0.2 millimeter precision. The toxicity is very, very low. So in general, Cyberknife has a very short treatment time, higher treatment precision, and few side effects comparing with the conventional therapy. So this is a real case that we treated in Philadelphia, in America many years ago. On the left side is a linear accelerator without gating. In the middle is a linear accelerator with gating. And on the right side is a Cyberknife. Again, you can see the color is a dose, right? In the center is a higher dose. The brown is a middle dose, and the green is a low dose. And you can see that all the doses is much smaller to the surrounding tissues in the Cyberknife on the right side. It spares a lot more normal tissue. In short, Cyberknife has a higher precision and fewer side effects. So this is the Cyberknife. Again, it's moving with the tumor on the left side. And the pictures in the middle mimic a tumor's motion with the lung tumor's motion. So in the LINAC treated tumor without gating is the big one. The big had a bigger green circle. So it treats not only the tumor, it also treats a lot more surrounding tissues like the lung. Versus the gating that you also treat a lot more tumor. Cyberknife is the only one that track tumor's motion. That tracks tumor's motion in real time. That's why CyberKnife is a much better technology, sparing the tissues and give higher dose to the lung tumor. So what happened when we treat? How do we use the CyberKnife? And here, basically, you can see this is the early stage lung tumor. You know, these days, many patients have a lung nodule, right? When the lung nodule is larger than 8 millimeter, we need to treat it. Conventionally, we treat with the surgery, and we have to cut the patient open. We have to take a big chunk of lung tissue out, and it's a lot of challenge. And the verse here, the red is the tumor, the white is the dose to the with the CyberKnife to cover the tumor with a 5 millimeter margin. With a 5 millimeter margin, we want to treat a 5 millimeter margin because we want to make sure the microscopic disease is also treated. Not only the tumor being treated, but also the cell, the cancer cell surrounding are treated as well. And this is what we see. In this case, we will give 5 treatments to treat this lung patient. Every treatment is 20 to 25 minutes. And there's no pain, no bleeding, no anesthesia. So every day, patient can stay at a hotel. And they come to treat for 25 minutes. Then go ahead and play tennis, go ahead and play golf. And as soon as they finish treatment, they could go back to the normal life. By the way, when we treat the early stage lung cancer, we have a 98.4% of local control for early stage lung cancer, as good as surgery, but much less side effect as surgery. Again, this is show you to the left, the CyberKnife tracking the tumor, versus with the Linac, CyberKnife treating much larger volume than CyberKnife. Okay, CyberKnife also treat a brain tumor. As we all know that 40% of a cancer patient will eventually develop the brain mets. The tumor will go to the brain. On the left side is an easy case, right? You only see one brain met, small 1 cm brain met. In the past, we have to treat the whole brain, and it costs a lot of side effect. It could take 10 days to treat. Now with the CyberKnife, many times we only need one treatment. I just need one treatment, 25 minutes. And we do not treat the whole brain. We just treat the tumor itself, and the patient go home right away. So the president of the United States, the President Carter, got the treatment just like this, very quick and easy. Now you see in the center, you see another case is the most complicated. That's the tumor in the brainstem. That's a patient in the brainstem. The patient has another tumor in the brain. So CyberKnife can treat the tumor in 3 treatments. Each treatment is 25 minutes. And we can treat these 2 tumors together. Remember, the tumor in the brainstem is very difficult for surgeon. You cannot perform a surgery for the tumor like this, and we can easily do CyberKnife. On the right side is another complicated cases. With 5 treatments, we can ablate this tumor easily, and just within 1 week. You do not need 5 weeks anymore. Just 1 week, we can get this tumor treated. So basically, it can literally save the life with the CyberKnife. Again, very minimum side effect. How about the liver tumor? Liver tumor is also very good application with the CyberKnife. On the left side is a very small tumor. We call it small liver cancer. And when the tumor is so small, we try to ablate the tumor. We try to cure this patient. So when the liver cancer is less than 5 cm, our goal is to try to cure this patient's cancer. So with the CyberKnife, remember the liver tumor also move with respiration, and the CyberKnife can move with this tumor as well. With 1 week, we can have a 95% of chance to cure this small cancer, liver cancer. So on the right side is the complicated cases. It's much larger. The tumor is about 13 centimeter, and also the next to the bowel. And we could also easily treat this patient, and we're going to use 5 treatments to treat this tumor. Prostate cancer is a huge application for CyberKnife. Today, I actually prefer to do CyberKnife than surgery to the prostate cancer. Why? You can see the red is a prostate tumor, the yellow is the dose, S-dose line is very, very conformal to cover the prostate cancer. And in other words, only with 5 treatments, you do not need to perform surgery to treat this prostate cancer. The patient still keep the sexual function. And for low risk patient, for low risk prostate cancer patient, we have almost 100% local control in 7 years. For intermediate risk, we have a 94% local control in 7 years and a very low side effect. So, but if you do surgery for the prostate patient and the local control is only 90%, the surgery's local control is not as good as the CyberKnife and also a lot more side effect. This is the spine tumor. Again, 30% of a patient will develop spine metastatic diseases. CyberKnife is so powerful that we can treat the bone, the vertebral body, at the same time spare the cord easily. So on the left side is easy case. We only need to treat 1 vertebral body. In the middle, we need to treat 4 vertebral bodies. It's very, very complicated. On the right side is the most complicated cases. We treat 3 vertebral body. We spare both cord and also the nerve. So it's very complicated cases. But the CyberKnife, thanks to the robot, is so flexible. It's so flexible. We only treat the tumor. We can spare the cord and also the nerve. We can spare the normal tissue. So clinically, there are more than 10,000 papers already been published, and all has shown excellent clinical outcome. For spinal tumor, many paper reports 90% local controls. For prostate paper, published by Memorial Sloan Kettering, the best cancer center in the world, it shows 97% of the local control.
哦，咖啡灌肠，你要跟他们讲咖啡灌肠。
Versus conventional radiation, only 89%. So what this means? What this means? CyberKnife in 1 week has 97% of rate of success. Conventional radiation takes 7 weeks, only have 89%. And the surgery is even worse. Surgery is even worse. So on the right side, the early stage lung cancer, the small lung nodule. This is the data that is published by MD Anderson in America, the best cancer center, of course, in the world. You can see for lung cancer, CyberKnife has better survival than surgery. CyberKnife has better survival than surgery. It has the same local control, but survival is higher. Why? Because the CyberKnife has much less side effects. So when we have an older patient, when the patient cannot tolerate surgery, the real surgery, or patient does not want the real surgery, we could definitely offer CyberKnife.
WellAgain, Total Healthcare Solutions.